And good evening to all of you, and good to see you again. And thank you for your submissions, which I was reading last night and earlier today, and to be perfectly honest, I found the information in them disturbing, horrifying, some of it, and we definitely need to broaden the conversation about violence against women in this country, but we need to much bigger emphasis on violence against disabled women, because I don't just think there's enough knowledge about it, and you know, a lot more needs to be done in general, but specifically for disabled women as well. I suppose some of the things that you talked about there, many of them questions have been asked already, but you mentioned there, and I know Eleanor, you were talking about a parent who was in a residential setting, and then because she became pregnant had to move into a residential parenting unit. I mean, what is the difference between this and the mother and baby homes? I mean, I'm really concerned about those sort of setups, and that that there weren't proper supports put in place for this woman to be able to live with her child once the child was born. I mean, and with the supports necessary. And our family resource centres, I know they do wonderful work in our community, supporting vulnerable families, but like everything, they do it on a shoestring, and they're not properly resourced, and they need to be. And if they were, a lot more people could live, in our communities, vulnerable people, single parents, whatever it is, and look after their children and not have this imposed removal of children that is happening. And again, there's a lot of things I found very disturbing in your reports, but I'm glad that we're talking about it, and it needs to be talked about a lot more, and measures need to be taken to address the issues. And I suppose one of the things there that hasn't been referred to in the question so far is you talk about and disabled women in Ireland in particular highlighted this, the genuine concerns that disabled people in Ireland may face significantly increased rates of obstetric and gynecological violence. And I mean, that a huge number of disabled women lost their lives giving birth, and has this even been incorporated into the maternity strategies? It's been looked at. Were you consulted with in any sort of a detailed way around the national maternity strategy? Is it inclusive of women with disabilities and meeting their needs? I suppose another issue as well, you're talking about disabled people find it very difficult to foster or adopt children. I mean, we hear from TUSLA all the time that they cannot get people or families to adopt or to foster children in particular. I just say adoption for anybody is a very long drawn out process, very expensive process. I've known of people who, it's been taken years to adopt children, they've almost given up. But there's some ridiculous things, like even one man, so he was too heavy, he needed to lose weight. I mean, if he and his wife could have had the child naturally, there were no restrictions on weight in those. I mean, it's just silly things. So the same seems to be applied to disability as well. These sort of ridiculous restrictions which would have no bearing on what kind of a parent they would make to the child. But just, I suppose, on the national maternity strategy and on the violence against women in maternity settings as well, if you could just maybe answer those questions. Thanks.
Okay.
Yes, there was an NDA report a couple of years ago, I think, on experiences of maternity services. So that's great to see. And it did find that it did look at kind of choice in maternity and postnatal support, and it did find that disabled women were far less likely to be offered choice, that they didn't feel that they were treated with equal respect or given equal access to information about their pregnancy and their options within that. I am not aware of any examination or tracking of obstetric violence. I have heard personal anecdotal accounts of it, but just want to say I'm not aware of there being any official monitoring or reporting on this. That doesn't mean it doesn't exist. It does mean I'm not aware of it, but it would be great if it does exist, if that information was more available to organisations such as Disabled Women Ireland. We were not consulted on the National Maternity Strategy, and I'll be honest, I haven't had a chance to read it in depth. I didn't see there being, in my scan reading, I didn't see there being a particularly strong focus on the specific needs or raising those facts that there is a much higher maternal mortality rate, a significantly higher maternal mortality rate for disabled women and those with pre-existing conditions, or for the other issues identified in the NDA report. I would very much like to see that being a targeted focus under any national maternity strategy, and also in the provision of services and particularly postnatal supports, well, not particularly more than maternity, but not just to be looking at the hospital setting, but to be looking at the ongoing care for that family as they're in the community. Another issue that my colleagues and colleagues in the CDLP have spoken very eloquently, but in regards to the kind of, the basically institutionalisation, a kind of mother and baby home type situation, for the dangers of that being an institutional setting, is also we need to place everything in the broader social context. So I do know a number of families that were able to cope with the lack of accessible accommodation available in Ireland before having children, but upon having children, were not able to raise a family in a house that was completely inaccessible to them, or an apartment. That is also a pressure which is forcing people into inappropriate accommodation, or potentially more institutionalised or congregated settings that don't need to be there. There just is not enough accessible accommodation provided. So I think we always need to try avoid siloing and really push on all avenues. There needs to be more, a higher percentage of accessible housing in all new builds, whether through social housing or on the private market. And I would say family resource centres are doing a fantastic job. We did have what felt like a very productive conversation with the parenting support unit in the department back in 2021, I think it was. And I think that could be a very useful avenue to continue exploration with, where disabled parents and those with lived experiences are able to come together and have conversations on supports that helped, supports that would have helped if they existed, and how those can best be delivered and targeted to families who need them.
As well, I suppose I thinking about your question about why do we still have these residential units, and I suppose, as Nem has already covered, it's due to, it's often that, not often, but too often, unfortunately, that disabled parents don't have any suitable accommodation to return to after the birth of their child. So they might just simply need accommodation, and that's why people are ending up there. But also there are obviously people, not just disabled people, maybe young parents and other people who might need more support than they can get wherever they're living, in terms of their parenting, particularly, with a newborn child. So the idea is that, like, well, this is the setting in which you don't just have to leave hospital and then be completely on your own. You can have the support by being in this setting where there is staff on hand to help you, and things that can be done to support you in learning things as a new parent. I suppose, again, though, ideally that would not be the case. Ideally people would have a safe and secure home to go to, and the support would be provided to them in their home, and that home in which they would be raising the child, because then you're learning skills in a very artificial setting, and then you're being expected to apply those in a different setting again. And so for some people that's just not a very effective way to learn those new parenting skills. So we completely agree that this is a practice that should not, ideally should not exist, and instead we would provide people with the support they need in their natural home environment and make sure that they have a safe and secure home in which to parent. That's not the case, sadly, for everyone. On the issue of, I suppose, again, the barriers in fostering, and how does that kind of how does that line up with the challenges that are expressed in finding suitable foster placements or prospective foster parents? I mean, I think Ireland is not unique in this kind of dilemma. One of our international colleagues in Iceland had to take a case to their Supreme Court as a disabled person who wanted to foster and was prevented from taking the a sort of a mandatory training course for all prospective foster parents, and they wouldn't allow her to take the course. And she is now successfully fostering. But one of the things that was said to her in this process was, well, because you have such a complex physical disability and you have personal assistants coming in and out of your home and in and out of your life, and that would be too confusing for a child to understand, like, who is their parent and who is the personal assistant. And as she has said herself, Freya Harrod's daughter is this activist's name. She has described how her foster son knows very well the difference between her as a parent and her personal assistants, because when he is cross at her, he will be rude to her and polite to her personal assistants. So again, I think children and young people are very well able to understand these differences, and it is perhaps our prejudices and our kind of presumptions about what people think about disability that maybe prevents us from having a more open and inclusive attitude to how many amazing, especially foster parents of disabled children. So disabled foster parents could make amazing foster places for placements for disabled children, and like that example we had of the deaf family that fostered was really, really positive experience for them, and that the mother in that family had grown up in a family where there wasn't any sign language, and so she really relished that idea of being able to give a child that environment of a family home in which their natural language was being spoken. So it would be amazing to see more of that, and I think more people would be willing to do it if they didn't experience the pushback in the early stages of the system, which kind of does tend to discourage people from going on to go into these roles.
Emma?
Yeah, John, I'll just add in there a little bit around more of those facilitators that have helped people with parenting and with their journey through their reproductive lives. Some of what's missing there is just the practical skills and information, I suppose, amongst the people who are supporting disabled people through their journeys. We had a number of respondents talk to us about the things that completely changed their lives, and it could just be as simple as a public health nurse who comes in and is innovative and open-minded and will try and find ways to facilitate that person's needs in early parenthood. And then it's kind of a lack of knowledge that goes through the healthcare system. It's at the surprise when a disabled person presents, perhaps in pregnancy or looking for reproductive assistance in some way. It's how do we get over that? How do we ensure that disabled people are seen as reproductive citizens, the same as everyone else, and are extended the same supports, or at least to get to the same place. So that part about not just creating strategies, but embedding skills and knowledge. And it's not all down to resources. I mean, a lot of it is, but some of it is also around building in knowledge and strategies in the existing resources that are there.
Thank you.